Good morning, everyone, and welcome to the MPTA Education Series this morning. We're going to give it just a minute or two as people join the call, and then we will get underway. Just as a quick reminder before we get started, please make sure you put all your questions in either the question and answer box and the chat box, and we will get to them as we move through the program this morning. And thank you again for joining us. Good morning and welcome again to the Missouri Public Transit Association's educational series addressing behavioral health on transit systems. Over the last 20 months and even before that, we had heard from our providers across the state about the need to address mental health issues on their respective systems. Many times what has been categorized as security issues is actually in fact an individual or individuals dealing with mental health issues. Today we have a really unique opportunity to hear from two individuals with the Chestnut Health System who are working closely with Metro Transit in the St. Clair County Transit District in the St. Louis region to move the needle on incidents on transit. First, before we get started, I know this is webinar style, but I would really like to welcome the MPTA board members who are here with us this morning. Thank you for attending and thank you for your leadership on public transit in Missouri. Now I'd like to welcome our speakers. We are lucky enough to have with us today Stacy Nonn. She's the Associate Director of Comprehensive Integration at Chestnut Health Systems. She joined their team in April of 2019 as the Medicated Assisted Recovery Coordinator. Sorry, Stacy, that's a lot to say in one little sentence. She has her bachelor's degree in criminal justice from St. Ambrose University and her master's degree in criminal justice administration from the University of Illinois at Chicago. We also have Emily Schweigel. Emily started working in the substance abuse department at Chestnut Health Systems in 2016. Emily is a certified reciprocal alcohol and other drug abuse counselor, and she holds a bachelor's degree in psychology from McKendree University. Through this initiative, her team will work to increase access for MetroLink riders to behavioral health and primary care services. So as I said before, we're going to leave time for questions throughout the presentation as well as afterwards. Please place your questions in the chat box if you have any, as well as the Q&A box, and I'll be monitoring both of those. But right now we're going to turn it over to Stacy and Emily. Thank you again for joining us. And they're going to start with about 20 to 25 minutes of presentation, and then we will definitely have a dialogue following. But thank you, ladies, both for joining us. I think this is a really critical topic at this time.
Thank you, Kim. So you guys, my name is Stacy Nunn. As Kim said earlier, I oversee several projects at Chestnut Health Systems. The St. Clair County Transit District project is one of our new projects that have been put in place over this last year. So we're here today to kind of talk about the ins and the outs and the the setup of the project and how we got where we are today. Emily and I will just kind of be going back and forth through the slides with you guys and presenting different information. At any point in time, please don't hesitate to jump out and ask a question, and we can definitely address it at that time. We just kind of wanted to start today with a little bit of background about Chestnut. Chestnut Health Systems was founded in 1973. We actually started out as a very small addictions treatment provider with 2 staff. Today, we have grown to have around 700 employees. Our headquarters are actually in Bloomington, Illinois, and then we have our southern region as well. One of the things that I think it's always important is whenever we set out a new project, we kind of look at all of our service lines and decide which service lines will apply to each project. So I put our service lines across the slide, and then we wanted to really focus on, with the St. Clair County initiative, our substance use services, mental health treatment, and primary care. Whenever we started this project, what we've come to find is that there's a lot of other service areas that are now tying in as well. When Emily talks about the data and the riders that we're serving, you'll hear a lot more about housing and other resources, and maybe, trying to be more preventative, different collaborations that maybe we weren't originally thinking about. So it's been very exciting this first year as we get moving. St. Clair County Transit District reached out to Chestnut over a year ago and basically identified some areas that they had concerns with. I think it's good to just kind of point out right from the beginning that, you know, they were created in 1981 under the Illinois Mass Transit District Act. They are funded by a certain percent of the sales tax. And so when we really sat down and looked at the budget and the funding to make sure it's sustainable, it was something that we knew if we had good outcomes and good numbers, it's something we would be able to put in place for years to come. One of the good things that we really wanted to point out, because it comes up quite a bit when Emily and I are presenting, is that this project is enhancing law enforcement and security. It is not meant to replace it. So we've done a lot of partnership building and training as we get the project set up. And really, our team expands beyond just our team of 2 that we're going to talk about. It includes the ambassadors with St. Clair County. It includes the security personnel and the local law enforcement. So as we kind of get into the details, it's something that we just usually start out with because it's come up in quite a few presentations. So when St. Clair County reached out to Chestnut, they had identified basically a cohort of riders that they were what they would call problematic behaviors. There was a lot of examples of different bus drivers or the drivers of the trains having, delays due to trying to handle different issues that were outside of the realm of what they could possibly handle in a day. And so some of these things that we talked about were, people sleeping on the train for hours at a time, people maybe exhibiting symptoms of a mental illness or drug or alcohol use. And, some of the other things that we saw were people just loitering or panhandling. We found that some of the riders were actually dropped off there by other agencies or given passes to use public transportation without any solution really in place. They were just given this as a place to go or to hopefully get a ride to go to services, but there was no warm handoff or connection there. So one of the things that, it was kind of good we want to just dive into is just the details of what happened when Emily and Nathan were hired, and she'll go into detail about that. And they really got out there on the platforms and started riding the trains to really see these problematic behaviors for themselves. So Emily, if you want to go ahead and just kind of jump in on the details and how everything's been going for the last 6 months.
Yeah, absolutely. So I'm Emily, and as Kim mentioned, I am the project coordinator, but I'm also one of the full-time outreach team members. And so the way that our team is set up is that we have a 2-person team, so Nathan and myself, that ride the train 40 hours a week alongside our TSS guard, which is a transit security specialist. We also ride on designated days throughout the week with the St. Clair County Transit District ambassadors as well. And the ambassadors are retired bus drivers, so they're very familiar with the operators, the area, common riders. And so all of us together are able to identify riders with some problematic behaviors, maybe some needs. It allows us to get some backstories on some individuals. So we're all really working together to identify individuals and then trying to connect them to those necessary services. The whole idea of the job is just to behavioral health outreach. So those who are unhoused, substance use, mental health, primary care, really anything that we can assist with. And so talking to individuals, identifying those needs, and then trying to connect them to the organizations that we've built relationships with. And that falls with shelters, food pantries, behavioral health organizations, so on and so forth. And then within this project, we do have an abundance of flex funds as well, which allows us to provide individuals with limited resources such as hats, gloves, maybe water, hand warmers, things like that, that maybe they just don't have, and that will hold them over until we can get them connected to a more stable organization. And so within St. Clair County, we cover the entire county. And so the first stop or the last stop is the Shiloh-Scott station. And then the very last one is the East Riverfront station. So throughout the week, we are riding from stop to stop, paying attention to the platforms, bus stops, engaging with individuals on the train. There are days that we are just on the train, not really getting off until we have to turn around. There are other days that we get off at a platform to talk to somebody, and then we're at that platform for an hour or 2 hours. So it's really just wherever the need is, wherever we feel like there are individuals we need to talk to, that's where we're going to focus, but the entire county is what we are covering. So when I mentioned earlier the behavioral health services, really it's connecting individuals to whatever they are needing, to whatever organization can help them as quickly as possible, and then trying to minimize the barriers that are going to keep them from getting those services. So we were very fortunate with St. Clair County Transit District, who donated us a vehicle to where we can transport individuals to shelters or hospitals or wherever they may need to go. If an ambulance is not an option, or if Uber or Lyft is not an option, the funds we have as well, we can use that. So we do have a lot of different options to help with transportation, since that is a barrier for a lot of individuals. We try to connect people to different screenings for intakes, whether that's for psychiatric evaluations, substance abuse assessments, housing, detox. And with our programs, our MetroLink project is considered one of our priority projects. So our staff have been great about trying to prioritize a lot of our referrals, considering that if we talk to somebody on a Monday, we have no idea when we're going to speak to them again, because a lot of them don't have stable housing, a lot of them don't have a phone. So being able to connect with them right there and try to get them linked to those services right then and there is a necessity. So Chestnut offers a lot of these services, but one of the big things is doing outreach with organizations in the county, because whatever Chestnut cannot help with at that time, somebody else will be able to. So in addition to all of that, we do have a crisis team in addition to a lot of other organizations in the county. Nathan and myself are authorized and trained on how to do involuntary petitions. So if there's an individual in a mental health crisis who we feel as though is a danger to themselves and they are not voluntary to go to the hospital, we can complete that documentation so they can be hospitalized for their own safety.
I think one thing really too, Emily, I want to add before we jump to the next slide is, you guys, it's important to think this is a pilot project for us. So it's the first year of rolling this out. We didn't have really any other examples when we researched around the United States to try to compare it to. So things like the crisis training that Emily and Nathan have went through over the last few months was something we didn't originally have in place. We knew that there were 2 crisis teams, but there was another one in addition to Chestnut that served the area. But what we didn't count on is the waits that could happen if they're already dealing with someone in crisis. And so there's been a lot of just change and updates as we've moved through the last few months, and just different training that we just hadn't thought about that now we're putting in place, with a lot of feedback from our partners as well.
So when we're looking at the project, the transit district had a lot of goals, Chestnut had a lot of goals, and then we came up with a lot of goals together. And so one of the big things that we have been focusing on is minimizing those all-day riders. And so nobody is just riding the train all day because it's fun. Usually that is a safe haven. There's something else going on. A lot of times we're finding that they are unhoused. So being able to identify those individuals who are riding for extended periods of time, maybe they don't have fare, don't have a destination, and finding out maybe where they're going, what they're trying to do, and then trying to link them to those services. Diminishing the use of alcohol and drugs and other problematic behaviors on the trains, on the platform, and just metro property in general. Also detecting individuals who maybe are symptomatic of mental health and being able to do early detection on those patterns. You would be surprised that one day you will just see somebody you haven't seen before, and now they're there all day, every day throughout the week. And so being able to kind of pick up on those things and just being very aware of, okay, now we've seen this person a couple times, they're wearing the same clothes that they wore yesterday and the day before. All right, let's talk to them. Let's see what's going on. And just our presence there too. What we have learned, which is a very neat observation, is that people are watching us even when we don't realize it. And so on days where, I'm out there, maybe my partner isn't out there just yet, they'll be like, hey, where's your friend at? I'm like, well, I've never talked to you before, nor have I seen you. So, but you've seen me apparently. So just our presence out there, people know that we're there. So if they do need something, that they can ask. Another big goal of ours has been just to improve the overall experience for everybody using Metro. Staff, riders, just making a very pleasant experience for everybody. And then one of Chestnut's big goals is to integrate all of the organizations, agencies, and services in the region. So everybody is working together. If we are serving the community, we're serving the same population, it makes sense that we are all aware of what services we are providing, and we have a good working partnership with each other. And then the goal obviously is to continue to find funding so we can expand this project. We want this to be long-term on the buses and have as much presence on the train as possible throughout the week and the day. And so, as I mentioned a little bit earlier, it really it takes a village to make this work. It started with Chestnut and the St. Clair County Transit District's partnership, but then we are very fortunate to have the Sheriff's Department's MetroLink Patrol Squad. And so having a working relationship with them, they have done excellent at responding anytime we need law enforcement or if we need the EMS. They've also done excellent with if they're responding to a situation, calling us because they feel as though maybe we will be a better fit for that situation. We've also had a really good working relationship with local law enforcement as well. Metro's security team, so they do have their transit security specialists, and then they do have a contracted security company as well, which they've all also done fabulous at helping us whenever we need them, calling us when there's problematic issues going on. And then we have a great relationship with CMT as well. We at every single platform have, I think they're like 6-foot ads with Chestnut, our phone numbers, QR codes, and they paid for that, got those up within the first couple of weeks of us being out there. So it's definitely been helpful. Anytime we have outreach events, getting that information out there. And then one thing I did not mention earlier, that's also been a great support. We do have a PRN staff as well. So we have, and I don't know what PRN stands for, I know it's French, but part-time as needed. So whenever Nathan and I have trainings or meetings, we do have staff that we can call that can fill in for us as well, which has been an excellent support. So we always have that presence out there on the train. So when we're looking at the organizations and agencies in the county, there are some that we lean a little heavier on than others. And so these are just some very common ones that we use. St. Vincent de Paul is a very well-known organization throughout the area, but in St. Clair County, they are our only drop-in center. So we have very minimal shelters in our county. We don't have any shelters for men. St. Vincent de Paul is a drop-in center where it's open 24/7. It offers a place for people to sleep without a referral. They serve 3 hot meals a day. They have a thrift store that helps with clothes. Individuals can take a shower there. And then they have a lot of other resources there as well. They help with IDs, jobs, taxes, cell phones. So we have relied very heavily on them. To the point where I've had to take a couple of them chocolates before because, you know, when you're taking people there all the time, it's like, hey, good morning, here's chocolate, and here's somebody else. So having a good working relationship with them because they have been so helpful. Salvation Army in the county as well has started to really try to resemble St. Vincent de Paul. They've been offering hot meals throughout the week. They also have what they call the sanctuary. So individuals can go in, they can have a warm place to stay during the day and also get linked to different services as well. In the county, we do have our housing resource hotline. One of the big issues that we are seeing with individuals is that they are unhoused. That's probably the #1 need that we are seeing. In the county, for any form of stable permanent housing, the referral has to go through the housing hotline. And so we call her multiple times a week. There's one woman named Shay who operates that hotline. I call her multiple times. She has been a tremendous help getting individuals connected to her so they can do an intake, do the questionnaire, find out what programs they qualify for, and then what the next step is. So for individuals who want to step outside of our county, we do have the United Way, which is what we go through in St. Louis. They also connect us to a lot of different resources as well. In our county, we have one behavioral health hospital. Touche operates as a normal hospital, but in terms of mental health and detox, that is the only one in the county. So whenever we have somebody who is in a crisis or in active withdrawal who needs a detox bed immediately, Touche is our #1 go-to before we start going to anywhere else outside of the county. We also use what we call intergovernmental grants department through the county. One of the great things in St. Clair County is that a lot of the individuals who work at the intergovernmental grants department are also on the Homeless Action Council Board, who are also working for the Housing Resource Hotline, and who are also working for the Housing Authority. So it is just really one big group of individuals that if you talk to them, you have a need, they can usually connect you with a lot of others. And the Intergovernmental Grants Department has a lot of programs in it, from housing to rental assistance, to utility assistance, to job training and job skill building. And so they've also been one of our #1 resources as well. And then comprehensive behavioral health, we have also used a lot, especially for our crisis teams. They are another behavioral health organization in the county. Chestnut Health System's crisis team covers every single town in our county but East St. Louis. Comprehensive behavioral health covers East St. Louis. So even though my team and myself are trained excessively in crisis intervention, we are trained in how to do those involuntary petitions. That is not our number one job. And there are times where we just need that extra support and assistance. And the last time that I had to call the crisis team from Comprehensive, they were there within 5 minutes. So they have also been a great help. So again, one of the big goals is building those relationships, integrating these services since everybody has the same goal.
So the next 3 slides, Emily and I put together after doing our first few presentations. There was a lot of questions that followed up. We received some emails about just the setup and how we got off the ground. So we kind of wanted to share just a little bit of details about the other details of the project we weren't really focused on at the beginning. So there was a lot of time that Emily and I put into staff development and making sure that we had comprehensive training plans. When we were recruiting, we were recruiting for individuals with a clinical background or a background in recovery support. And so it was a wide range of backgrounds that we were bringing people in, and especially with our PRN team as well. So if they did have, experience with substance use, maybe they didn't have very much with mental health services. Same thing, you could flip it. Maybe they've had experience working with those with mental health, but not so much in substance use. Or Emily can talk about, like, Nathan had been a recovery coach for almost 2 years. So his outreach was very strong. He is very comfortable walking up and engaging with someone, where Emily had more of a clinical role. So she was in the office. So we basically sat down and came up with a pretty comprehensive training plan. So everybody now has this very similar skill sets when we're out on the platforms and on the trains. The other big piece of this is we spend a lot of time throughout the year on team building. And making sure that our team has that trust, that they rely on each other, that they're all reliable and they really have each other's back. Because I think without that, we would really struggle having the success that we've had. We do a lot of extensive outreach. Emily definitely talked about the partnership development. We're going to talk in 2 slides about expanding right now into St. Louis is one of our main focuses, and just in a few slides. But one of the things that was huge to the success that Emily's had is the outreach she did ahead of time, really letting people know that we're going to be out there before we hit the streets and before we were on the trains, and let them know that we may be calling you and what's the best way for us to do that, and what information do you need from the rider for this to go successfully. So a lot of that was all done before we actually started. And then data reporting. Everybody knows we have to be able to show what we're doing is working and who are we helping and where do our referrals go. So we have quite a few spreadsheets. We're actually working with Bi-State now with one of their staff to come up with a fillable form that will be a little bit easier on our team to gather the data. And Emily's on the next slide going to go into that in more details. But they, all of our team right now does extensive observation notes at the end of each day about all of their encounters. And then we're trying to roll out now a pre and post. So this is how the person's doing the day we first engage with them, and this is how they're doing a few months later. So definitely lots of good data collection. Here is a picture down here of Emily and Nathan, then our PRN staff that were all in place this fall. And so I thought it would be good for Emily to kind of just go over some basic data, and then we can kind of close out and take questions.
So this is an example of one of the 4 graphs that end up going on the monthly and quarterly reports. And so since the start of the project in April to, I think, the end of last week, the team in St. Clair County has had 845 interactions with riders. So it's not 845 riders because there are some repeat interactions, but 845 interactions. 131 of them were directly connected to services. And so what that means is that they actually stopped what they were doing. They sat down, they came back to the office with us. We made phone calls, we scheduled appointments, maybe we transported them somewhere. At the end of that interaction, they had an appointment or they were at a location where they were receiving services. The difference between that 845 and the 131 are the individuals that either declined those services or accepted the business card and the information and said that they would follow up with staff or they would call on their own. So since we started the project, we ourselves have transported 33 riders ourselves. We have provided 38 riders with train or bus passes so they could go to an appointment or go to a drop-in center or go to the hospital. We have had 12 of them transported by the EMS for either mental health or a medical condition. We provided 47 backpacks and tote bags with resources. And so that includes not only just like business cards and resource cards, that includes some, small toiletries, maybe water, hand warmers, kind of depending on the time of the year and what the needs are. We haven't administered yet, but we have provided 38 riders with Narcan. And then on Overdose Awareness Day, we provided 37 additional boxes of Narcan to riders, which are provided to us by our preventions department. So on the screen there, if you could just flip back real quick, Stacy. And you don't necessarily need to. So the chart just shows kind of all of the specific resource or the direct services that individuals are linked to there at the bottom. So you have your detox, the substance use services, Narcan, so on and so forth. So I definitely track all of those direct services specifically. And then I also break it down to what station were those direct services at, engagement at stations in general, observations and what that trend looks like. And then in recent months, we've also started doing secondary referrals as well, because the reality is that most individuals, when they come in and meet with us, it's not just one thing that we're addressing multiple things.
Okay, so we wanted to kind of finish today with, Emily talked a little bit about doing things a little bit outside of the box of what the original project scope was. So when she talked about Overdose Awareness Day that they held, there's a picture of Nathan interacting with one of the riders at one of the stations and being able to get more Narcan in the community and really provide more information. These were things that originally we didn't have on our radar, but we realized they were important. And, Emily will tell you, like that first day when we were out there for Overdose Awareness Day, you just don't know how it's going to go. You could have no one show up. You could have 1 or 2 people, and they ended up having a pretty big success. So they went ahead and did, during the Homeless and Hunger Awareness Week, another food drive at the Belleville station, where, I think, Emily, there was 17 bags that had basically Thanksgiving themed food for those to take with them that were given out. And then another 30 bags of just essentials, food essentials that people felt like they were in need of. And then another 31 bags of things basically just to kind of stay warm. So like gloves, hats, maybe warming blankets, those kind of things were handed out as well at the food drive. One of the other new initiatives that Emily, when we really talked about it, realized we needed to do was we have a lot of partners that are involved. They were involved from the very beginning, but then we had those agencies that maybe smaller municipalities that just weren't in the loop of what exactly we were trying to do and what our team was out there doing. And so Emily's done a lot of just very specific law enforcement outreach right now in St. Clair County of really calling and trying to set up a meeting with the chief or assistant chief to say, hey, we're here, we're on the trains, this is who we're working with. If it's something we can assist with your officers or something that, we can kind of refer back to you guys when there's a need. And that's been very successful these last few months. There's been a lot of very receptive, conversations where people are on board, they want to know more about it. And then probably the largest thing that's going on right now is Bi-State received funding to put 2 more teams of 2 in downtown St. Louis. So we will have a team of 2. The goal is in the next few months in place at the Civic Center station, which is right across from where the Blues play, and then at the North Hanley station as well, over more by Umsel and on the way to the airport. And so right now, Emily and I are working on hiring and recruitment. We have quite a few good candidates that are in line that we're trying to finalize some offers with over the next few weeks to expand the team. That will look a little bit different over there on that side. The 2 teams will be more stationary at the larger bus and train hubs. Again, working with law enforcement and security, but very similar in what we're trying to accomplish and the outcomes that we're hoping for. So with that, Kim, if you wanted to, we can I just put our information up here, but I can go ahead and stop the sharing and we can kind of go to questions if you want next. Oh, Kim, you're muted.
Sorry, everyone. I did want to start off with a question while we wait to see if any other questions pop up in the Q&A box or the chat box. Please put your questions in there. We are happy to see those and answer those. But I looked at our participants who are on our webinar this morning, and they represent all different types of providers, from small rural providers to one of the largest rural providers in the country, Oates, as well as some of our other providers in Springfield and other areas like that are all bus-based systems. So there's no other system that on the call that I can see right now that is dealing with a permanent light rails or train system. So in your opinions, now that you've been doing this for just shy of a year, what would be your recommendation for these smaller systems and these bus-based systems on potentially addressing mental health on their systems? Would they set it up the same way? Do you think that it would be set up differently? From your experiences, any, words of wisdom that you can give these smaller providers?
So it'll be good. Emily, I'm going to let you take this, but I think it would be good to acknowledge that the overall goal eventually is for us to have people as well on the bus systems. That's long-term goal when we actually would be able to expand our team. And we've definitely, Emily's done a lot of thinking on different things expanding and what that looks like. So Emily, just kind of want to share some thoughts on what you think would be most beneficial.
Yeah, so it's to make this work, it's a little bit of being in the right place at the right time, and then having a good communication amongst, operators, law enforcement, and then staff. So there have been, as I mentioned earlier, we do pay attention to the bus stops. We have had a few situations where we have been contacted because there has been an issue on the bus. And by the time they make it to a bus stop that is by the MetroLink, they can't get an individual off the bus. And so we'll get on the bus and we will address it. And so I think the best way to go about it is trying to mirror it as similar as we are doing on the MetroLink. If you are to set up a program like this, having individuals, ride a bus route, hop off, hop on another one, just kind of be present. And then also having the operators aware that, okay, the team is out there, I have an issue, I need to call them so they can meet us, and then they can use their skills. Because a lot of times individuals are using, from what my experience is, using public transportation because that's a safe place for them. They have nowhere else to go. It's safe. They can ride it all day long. It's warm or it's cool. And a lot of times that, especially if there's mental health, you have to have the right skill set to address them without escalating it further.
So you guys have been doing this for about 9 months now, right? Mm-hmm. So what have you seen are the biggest challenges or pitfalls as you got this program up and running in St. Clair County, and as you move into potential expansion that other providers might want to be aware of as they consider any type of mental health program for their sites?
So I did want to say we've been very fortunate with the team we brought on. I know that when we've talked to other providers, taking your time, I think would be probably not rushing it would probably be one of the things we'd recommend the most. I think some challenges a lot of people are expressing right now is finding workforce, right? Being able to hire the right people that have these skill sets. I think instead we were looking for the right personalities, and we're going to go ahead and train them on our end. So we kind of opened up our job descriptions to say, you don't have to have this degree or this certification yet. We really need the right personalities that can go out and be empathetic and caring and work hard. And then we're going to teach you the rest of the skills that we want you to have out there. So I think it's going to be challenging hiring. I think hiring is just going to be that everybody should expect to do a lot of recruitment, spend a lot of time. We spend a lot of time on our recruitment, and really finding the right individuals. I think that would definitely be one area. I think that Emily will tell you we're very fortunate in rolling our project out. We've had a lot of good responses. Something we were talking about earlier, people seem to want to help and be on board. I don't know that you're going to get that everywhere when you have limited resources. I think people are spread pretty scarce in the rural counties we work with, and to ask them to take on more referrals or more responsibilities might be a little bit challenging for them. So really trying to weigh with them the benefits of being involved in a project like this, or seeing what support they may need to take on more referrals so you don't overwhelm everyone will definitely be something that would have to be talked through and worked through. Emily, are there any other big challenges that you could think of that people should just kind of have in the forefront?
Yeah, and this will also go with a piece of advice. And COVID has played a huge part in this. Resources are definitely limited. I was doing some, professional outreach the other day from Missouri, and I had a long list of different places that provided meals and food pantries. And of the 20 that were on my list, maybe 5 are still open. So that's definitely a huge challenge. So outreach is incredibly important because it's the niche programs that are going to help the most. You can have the big organizations and agencies that do great things and offer all those services, but it's about talking to somebody who knows somebody else who's doing that little thing that is not very well known. For instance, like in our county, one of the individuals who works at a very big agency on her own has developed a program called Suds of Love. And it's where one day out of the month, it's open for 2 hours. People can come and do all their laundry for free. So just knowing those little niche programs, because those are the ones too that help a lot of individuals.
Okay, so Brandy has a question for us. If a funding stream has yet to be identified for this type of program, but an agency wants to get a proof of concept, do you think a program like this could be successful utilizing college programs that have college students needing experience, as long as it was supervised by a professor and as a partnership with the agency?
So we definitely had, we did have a couple of people bring up the idea of using interns if we weren't able to hire or find staffing. I would say it would just depend on who's overseeing it, supervising it. Emily is she is part of the team in St. Clair and supervises it. And she will spend at least a day a week with the team in Missouri, once both those teams, she'll spend a time with them too. I think that it depends how well you can train everybody, because they're going to have situations they've never been in before. And they're going to have lots of questions, and they're going to really need to reach out and feel that support where they're not on their own when they're responding to something. So I would say that it's a possibility, but it would take a lot of work and oversight on someone's part to be available a lot of the time for the team. Because I mean, that is right now, it's a huge training curve our first few years. All the new team, these 4 new staff we're about ready to bring on, we know the first 6 months, they're going to have a lot of questions. Emily's going to have to be available. So she's going to have to be a phone call away at least to be able to help if there's something going on. So I think that would be a huge part. I would definitely say, Brandy, if you guys start working on it and you wanted to reach out, we'd be more than happy to provide some insight and guidance or just feedback on what we've been through this first year that maybe you guys could take into consideration.
So could you both talk a little bit more? You touched on it, but just so people are aware what your actual team looks like, Emily, that it's yourself and Nathan, and that you're partnered with a TSS and then potentially other partners that you have while you're out on the system. If you could touch on that a little bit more, I think it might shed some light on that you're not usually out on the system by yourself interacting.
Yeah, so you're always with a teammate. And so Nathan and I, or if we have a PRN is filling in for us, we are always together and we are always with our TSS. So we are always on the same platform together. We are always on the same train together. And this is something that you learn too. When we first started, whenever we saw somebody in need, all 3 of us would go up to that person, which can be a little intimidating. And so we've kind of learned now when we get on the train, we kind of spread out. We're always in each other. Everybody's watching each other just to make sure that if there's something that somebody needs support with, that we are there. And so we are always together. The ambassadors, a few days out of the week, as they're doing other things, because as they ride the train and they're doing surveys, they'll be on the same train with us. And as everybody's getting phone calls from security or law enforcement, we're communicating with one another, getting off the train together and being present. So the safety is the biggest thing. So making sure that we are always together, we are always there for support, because there are situations where when you're engaging with an individual, you need your partner to look up some information or get some resources. You may need security to dispatch EMS or law enforcement. So it's definitely a team effort at all times.
Okay. Okay, do we have any more questions from our participants in the chat box or the Q&A? What do you, since both of you have been working on this now, what do you think has been the most significant win to date?
I would say how many people they've actually been able to engage and connect to services, Kim. When we started out, I think we were kind of like, we can't even guess on what that will look like monthly or weekly. And I think it's important too, I probably should have mentioned at the beginning, we had planned with St. Clair County that we would have several months of observation where we would just be out there observing. And I think because we have the right people in place, and when Emily and Nathan were put on the trains right away and they saw people in need, they just kind of jumped in and we started seeing, the people and talking to them and engaging and started the referrals right away. So it was interesting just to kind of see the numbers start coming in right off the bat, month after month, where it's not, everybody, it may take 4 or 5 times for some people, but eventually just their presence has been able to connect so many riders so far that we just weren't expecting actually to service, and in that warm handoff sense, where we're not just saying here's a card or here's this place you can call, like we're actually connecting them, they're going and receiving a service. So I think for me, that's probably like a very like proud moment of the project and how much hard work they are doing out there, is they're starting to have those outcomes. Emily, I mean, for you, what's your big win so far?
I would say in addition to that, just the support and excitement that we're getting from other agencies and organizations, especially in the area. There's a meeting that I just learned of in the county where people are getting together just to share what they are doing and how they can help each other. And I went for the first time last month, and the amount of people who came up afterwards and was like, this is so interesting. Like, give me a call sometime. I want to learn about it. I would love to help with this. Like, it's very nice to get that support and knowing that there are so many different individuals out there who actually just want to help other individuals. The idea of people helping people is what does it for me.
So Anne would like to know how many ambassadors you have. I don't know, Stacy or Emily, if you want to talk a little bit about the ambassador program as well, or I'm happy to touch on it, but she would like to know how many ambassadors you're working with.
I could touch on it a little bit. Kim, you might have to provide more detail on it. There are 2 in St. Clair County. So they are retired bus drivers who now work, and they have very different roles. So like one of them focuses a lot on like the St. Clair County District's bike trail and making sure that that is maintained. As another one rides more of the train, talking to the operators, doing surveys with the riders, and really just making sure everything is coordinated, making sure the logistics of everything's clean and organized and coordinated. Anytime there's events, grand openings of the bike trails, they are there to represent.
And the whole purpose of the ambassadors. So when we're talking about the St. Louis system, there is the Missouri and the Illinois side. The Illinois side is managed by the St. Clair County Transit District, and they contract with Metro Transit for the service over there. So that includes the light rail system in Illinois. There are 11 stations currently, as well as the 16 bus routes, the Metro bus routes over there. So they contract with Metro Transit for the actual transit service, but the St. Clair County Transit District manages the system, and they put a significant emphasis on customer service and customer engagement. So that is truly the role of the ambassadors. They are out there as information officers and assistants, and they have been partnering with the Chestnut Health team as well. They're on the ground. They know the riders, they know the operators, and they know the system like the back of their hands because they were operators prior to being ambassadors. So it works really well in St. Clair County, the ambassador team that they have. Another question that has come in is, what is the population of the area you serve and the total number of staff that you have? And I think this is where it's really amazing.
So I know St. Clair County, just from another grant that I work on, I know there are around 255,000 right now. Does that sound right, Kim? I know it's been down a little bit over the last few years. So it's around 255,000. That's probably a good idea to put this in, is how many riders we have. When we were brought on to this project last spring, I know ridership was down. It had decreased, I think, Kim, by 50% from the years before COVID. So, I mean, our full-time staff that we have right now dedicated to this project is Emily and Nathan. I oversee Emily, so I have a small percent that I'm just there for supervision and help with the project. And then we do have the PRN team. So we have one PRN staff that works a minimum of 1 day a week. We try to get her 2 days a week as we're expanding the project. So when we get done hiring, hopefully we will have 6 full-time staff that are dedicated to the 3 teams. And then we'll have a PRN team of 3 or 4. With that being said, we do have hopes. We're reviewing the budget for year 2 for St. Clair County right now to expand to another team of 2 over there. So not a lot of manpower, but definitely lots of good outcomes from the area that we're trying to cover.
So two clinicians on the ground right now with 1 part-time support staff is what they currently have. And we saw the metrics that the metrics are incredible in my mind, considering there are only 2 clinicians on the ground right now. And so they are touching a lot of riders and individuals with a very small team. So again, like I want to make sure some of our small providers and rural providers know that this isn't a team of like 20 clinicians on the ground, it's 2 people. Any other questions from our cyber audience out there today on mental health on transit? So Stacy and Emily, if you're okay with it, if we would love to attach the PDF to a recap of this event on the website as a resource for all of those who participated today and others. And if anyone has any questions following this or would like to chat with either one of you about, you know, possibly looking at doing this at their sites, is that information that we can promote as well?
Yes, of course.
Okay, great. Okay. Well, I don't see any other questions today. I want to thank you both for your time. This has been super valuable. And I think it's something that's going to continue to gain momentum as we are seeing these issues on small systems, on large systems, pretty much across the board. And I think the pandemic has just intensified the situations that we're seeing on the system a lot of times. So I appreciate your providing insight and example, and hopefully next year, after you've been on the ground for over a year, you'd be willing to come back and talk a little bit more about some new lessons learned as we progress through this program getting up and running in the St. Louis area. So thank you very much for your time today. We will have a recap on the website. If anyone has any other questions, they can let us know at info@mopublictransit.org, or you can check out the website at mopublictransit.org for additional information. Thank you to everyone who attended. Also, please make sure you're checking out the website. We have several education series events for the beginning of 2022 that we want to make sure that you're aware of. So please consider joining us. Happy holidays, everyone, and thank you again.
Bye, everybody.
Thank you.